Speech disorders are very common disabilities in the education world, from students who suffer from omissions to more severe cases when they have a stuttering or cluttering problem. This disability is very often seen in the classroom. Here are some of the definitions you will need to know to fully understand speech disabilities. Articulation is how the word is pronounced. Speech sound errors are distortions, substitutions, additions, and omissions. Fluency disorders is normal speech disrupted by sounds that are repeated, avoided, or prolonged. Voice disorders are produced when air from lungs is pushed through the voice box into the throat. There are two types of language disorders. Receptive language is trouble understanding others, and expressive language is trouble sharing ideas, feelings, and thoughts. Aphasia is the loss of a previous ability to speak or understand language. This is due to an injury or disease of the brain.
Substitution.
I ran the race.
Omission.
I rode the cool bus this morning.
Addition.
The cat ran fast.
Distortion.
There are very important
The
learning
fan is
characteristics
off.
that you need to know when diagnosing a speech disorder. Speech sound errors are substitutions, omissions, additions, and distortions. Substitutions is when a student substitutes one letter for another. A really good example of this is waste instead of race. Children often believe that they are saying the word correctly, which makes them very difficult to correct. An omission is the leaving out of certain letters or sounds, such as cool for school. The dropping of consonants from the end of the words cat for cat. An addition is the addition of extra sounds. This makes comprehension difficult for the learner when reading. And a distortion is a lisp or whistling noise. This can cause a misunderstanding in teacher-to-student communication, but eventually the teacher and student will become accustomed to it. A distortion is when sounds are more distorted than intended phenom than the sound it is supposed to be. A fluency disorder is either stuttering or cluttering. Stuttering is the audible repetition of a syllable or sound, or an inaudible block or pause, which is very inappropriate. Cluttering is when the learner begins sticking and chunking words together. Fast talkers often suffer from this. There are two types of voice disorders. Hypernasality, which is too many sounds that are being pushed out of the nose. This is often called talking through the nose. And hyponasality, which is not enough sounds coming through the nasal passages. This type of speech disorder will sound like the student has a cold, but actually does not. Phonation is a disorder that causes the voice to sound breathy, forced, or husky. Sometimes this type of disorder can happen from natural causes, such as irritations of the vocal cords, or it can come from vocal abuse, such as screaming or yelling. A language disorder can be expressive or receptive. An expressive disorder tends to be socially withdrawn, and children often have trouble expressing needs and wants. In a receptive disorder, the child has difficulty comprehending information and has trouble recognizing common objects, understanding directions, or knowing vocabulary. Some of the key issues that are involved in speech disorders is the acquirement of language. The teacher must understand that the process of learning language is different for every child. Understanding how early a typically developing child acquires language is important to the teacher who is working with that specific child. The social and linguistic environment also affects when and how a child will learn to speak. In a study conducted by Hart and Risley, they conducted monthly, hour-long observations of children from 42 diverse families over 2.5 years. Their findings showed that children from 11 to 36 months were exposed to the most spoken language. The study recorded an average of 700 to 800 utterances an hour that was within the child's earshot. Repetition is the mocking of words and phrases. Children involved in the study conducted by Hart and Risley also demonstrated a parrot type of communication. They repeated the words they were taught through oral communication over and over again. These children will also come to learn how to talk and describe things to themselves as they played.
Challenges faced due to communication disorders. Teachers' challenges. While teaching, teachers may have trouble training and because they do not know how to teach children with communication disorders. They feel they don't have the qualifications to teach these students because they've never learned about the disability. Treating disabled and non-disabled students equally may be more difficult than you might expect. Discrimination. Encouragement of the rest of the students to accept their disability. And you must make special tests designed for communication disorders where it may be harder for them to understand or be able to comprehend the material. Students also face many challenges. Reading and comprehension. As said, students have trouble understanding words and vocabulary. They may get jumbled up or mixed up in their head. Discouragement when unable to pronounce words or read a book. Then social skills. They may misunderstand social cues such as specific gestures, postures, or facial expressions. They experience difficulty understanding and expressing language. Different instructional strategies. Classroom strategies. Verbal. Encourage participation, but do not require a student with difficulties in communicating to speak in front of a classroom. They may feel anxious or anxiety. Permit students time to speak without unsolicited aid in filling in gaps in their speech. Let the children speak, but only if they want to. Do not be reluctant to ask students to repeat a statement, for they may feel insecure or unable. Address students naturally. Do not assume that they cannot hear or comprehend. Do not make them feel inferior because they are just trying to learn like everybody else, and they feel left out. Patience is the most effective strategy in teaching students with speech disabilities. Make sure you have time to understand how the student is feeling and to make sure that they are thinking clearly. Alternatives. Allow students who are unable to communicate verbally an alternate way to do so, which is such as a typewriter, word processor, signboard, or interpreters in class. If you do not understand what has been said, do not pretend to know. Tell the student you do not understand and allow them to repeat themselves. For oral muscle control, such as strokes, tumors, multiple sclerosis, and cerebral palsy. Oral motor therapy addresses sensory processing as well as disassociation, grading, direction, timing, and coordination of the mouth movements for eating, drinking, speaking, and other mouth activities. Oral motor therapy was designed to increase their coordination and stamina of the jaw, lips, and tongue. During the therapy process, oral motor exercises to improve speech disorders include stabilizing the jaw, pursuing the lips, alternating lip postures between pucker and smile, dissociating the tongue from the jaw, slowly moving the tongue tip around the lips. Some of the different activities used through oral motor therapy to strengthen the mouth muscles include sucking through a drinking straw, blowing cotton balls, horns, whistles, and windmills, chewing a piece of plastic or gum or a rubber object, licking peanut butter and other foods from around the mouth.
The following are examples of oral motor exercises to improve speech disorders. This includes stabilizing the jaw,
The instructor would hold your jaw like this,
pursing of the lips, alternating lip posture between pucker and smile, and disassociating the tongue from the jaw.
Argumentative and alternative communication. What this is the use of communication boards, high-tech electronic devices such as an iPad or an iPod, manual signs, and any form of aided or unaided communication. This is usually the first strategy used because it's a play in the natural development of speech. Evidence of if this is effective. In the 6 studies identified by the author, 89% of the cases had an increase in the speech production after the introduction to AAC. The ultimate pairing to create a greater chance of speech production, according to a study by Yoder and Layton, was that an AAC was most effective when verbal models were provided in conjunction with it.
So Slade was diagnosed with autism just before he was 2, and he lost his ability to speak.
Hello, I'm Slade. I live in Phoenix.
And so we worked as much as we could with all the therapies that were available, and we learned a couple years later that he also had apraxia. And this is a planning issue, so when you're trying to speak, it's very frustrating. And he used to hit himself and bite himself and cry a lot. It's hard to even explain how painful it is to have your child not be able to tell you what they want and be that frustrated about it and have that frustration last a really long time. So to have the breakthrough of, I would like this, or I would like to do this, is very rewarding for Slade and for me as a mom.
My mom understands me. We laugh all the time.
Now we can see what Slade would like to do or say or hear or eat or something.
Ice cream is my favorite.
And there's nothing that can be said that's more important than the power of that speech.
Goodbye.
Minimizing the pressure to speak. High-pressure situations can have a negative impact on speaking abilities and performance. Anxiety impacts motor performance. General responses to stress involves the activation of the sympathetic nervous system with the inhibition of the parasympathetic system. The results of this may include disruption of breathing, increased tremors of muscles, and altered sensitivity within articulation regions. How do you minimize the pressure to speak? Avoid direct requests for imitation, avoid test questions, and minimize time pressure. Puppets for use as interactive partners as well.
Imitation of the child is very important. According to Hayden Program, one of the best ways to connect with children who are just beginning to learn how to communicate is to imitate their facial expressions, sounds, and actions. This is most useful when a mother or parent begins to imitate. Then the child sees them as a model and will be more likely to continue that imitation. Exaggerated tone is one of the most commonly used techniques to learn how to imitate. The best way to facilitate this type of learning is through song or a much exaggerated tone. Augment auditory, visual, tactile, and proprioceptive feedback is the enhancement of sensory feedback to the child that is beginning to imitate sounds, words, or phrases. This can include colorful pictures, jagged lines, or fireworks that are in response to loudness, duration, and pitch of the child's voice. This is most often used in a computer program, but sometimes you can use it while speaking loudly and facing the child to accentuate the visual and auditory characteristics of the targeted sounds. Talking into a microphone, PVC pipe, or any type of chamber that creates an echo noise is also very useful. Focus on function. Sensory motor control of speech is distinct from non-speech oral motor behaviors such as emotional expression and vegetative functions. Helping individuals form an internal model of the target motor plans and sensory consequences and can emphasize the goal or purpose of the motor task, which is stressed as important. Focus on function by using motor activities, body positioning, and articulator movement and resistance exercises, which should be used sparingly. If working on alveolar sounds, tongue clicks would be suitable for that tongue protrusion or wagging. Blah, blah, blah. If working with an alveolar sound, tongue clicks would be more suitable than tongue protrusion or wagging.